What is the correct PERT dose for different foods? Imagine trying to enjoy your favorite meal without worrying about digestive discomfort. That's where pancreatic enzyme replacement therapy comes in. But how do you know the right dose for different foods? Let's explore that together. The key to effective enzyme therapy is tailoring the dose to what you're eating, especially the fat content. The main enzyme involved is lipase, which helps break down fats. For most adults starting out, a typical dose is about 30,000 to 40,000 lipase units with each meal and around 15,000 to 20,000 units with snacks. This initial amount usually helps control symptoms like greasy, foul-smelling stools. If you want to be more precise, dosing can also be based on your body weight. For example, if you have complete enzyme deficiency, your doctor might recommend around 500 lipase units per kilogram of your weight for each meal. For larger doses, the maximum can go up to 2,500 units per kilogram, but it's important to adjust based on how you feel and your symptoms. Now, what about the fat in your food? The amount of lipase you need depends heavily on how much fat you're eating. For each gram of fat, you might need between 500 to 4,000 lipase units. So, if your meal has 20 grams of fat, you could need anywhere from 10,000 to 80,000 units of lipase. That's why high-fat meals often requiring a higher dose of enzymes, while low-fat snacks need less. When taking your enzymes, it's best to do so with the first bite of food. You can split the capsules during the meal if needed, taking part at the start and part during or at the end. Never crush or chew the capsules, but if swallowing is tough, you can mix the contents with soft, non-chewable foods like applesauce or yogurt and swallow immediately. Usually, starting with 2 to 3 capsules of 20,000 to 25,000 lipase units per meal works well, and you can increase or decrease based on how your symptoms respond. Adjusting your dose is crucial. If you notice ongoing symptoms like greasy stools, bloating, or abdominal pain, your healthcare provider can help you fine-tune the amount. Regular follow-up with your doctor or dietitian is essential, especially if you have pancreatic cancer or other pancreatic conditions, because your enzyme needs might change over time. In cases of pancreatic cancer, where pancreatic function may be reduced but not completely gone, enzyme doses often need careful adjustment. Proper enzyme therapy helps improve nutrient absorption, maintain your strength, and enhance your quality of life. Remember, everyone is different, so what works for one person might not be perfect for another. Always consult your healthcare team to find the best dose for your specific needs. In summary, the correct PERT dose depends on how much fat you're eating, your body weight, and your individual response. Starting with around 30 to 40,000 lipase units per meal is common, but doses should be personalized and adjusted over time. Keep in close contact with your medical team to ensure you're getting the right support for your digestion and overall health.